welcome Dr. Mutalik, and thank you very much, sir, for sparing time today to discuss autoimmune blistering diseases.
Thank
Sir,
you. Thank you. And it's my pleasure and duty to make people aware of these dreadful diseases.
right, sir, thank you so much. If you could start with the first fundamental question, sir. What are autoimmune blistering diseases?
See, the name itself suggests blistering diseases means one gets water filled bubbles not only on the skin but also inside mouth, on the private parts, and which break open and leave behind wounds and makes the life miserable. Autoimmune means it. I can give you an example of a terrorist. A terrorist is produced from our own people, and it gets converted into, he or she gets converted into a terrorist, and they destroy our own country. Similarly, some cells or antibodies which are already there in our blood, they start destroying our tissues, maybe skin, maybe kidney, and those are known as autoimmune diseases.
Right, sir. Sir, in this, what is pemphigus?
Pemphigus is again a blistering disease. I will give you an example. You have a brick wall. The bricks are like, the cells are like bricks, and the cement or a glue which holds the bricks together to form a wall. Similarly, a skin layer is a wall made up of many cells, and there is a glue or interconnecting threads or cement which gets destroyed due to this autoantibodies, and then the skin disrupts, a blister is formed, and it leaves behind a wound. This is pemphigus.
Thank you, sir. Sir, what are the symptoms that should make one suspect pemphigus?
See, flaccid blisters on the body, or some erosions in the mouth, even on the tongue or the underside of lips. The patient cannot talk, the patient cannot eat, or even drinking water becomes painful.
Okay, sir. And what is bullous pemphigoid?
Bullous pemphigoid is another group of blistering disorders where the antibodies, the autoantibodies attack the lower portion of the skin layers, which gives rise to very tense blisters or bubbles like a balloon. And these are usually affecting elderly people. Majority of the patients of pemphigoid are above 40 years of age, and they usually occur on the body folds, say underarms or groins, and they leave behind scars because it is deep underneath the skin. They can also start in the mouth. Sometimes scarring variety of pemphigoid is there, which can affect the eyes, the private parts, mouth, or even the larynx.
So, what are the causes of these diseases?
As I told you, it is an autoimmune disease. That why these antibodies are produced which destroy our own tissue is still not known, but the scientists and researchers are working hard to go to the root cause of these kind of diseases, and there is some ray of hope which is giving a clue to newer treatment modalities to treat these dreadful diseases.
So, which physicians or which physician to consult for such diseases?
If it occurs in the mouth, usually the mentality or the human nature is that they consult a dentist or a ENT surgeon. That is fair enough, but along with the dentist or ENT specialist, one should also consult a dermatologist, because mucous membrane or the mouth and the private parts, inside the private part, what we call as a mucous membrane, is a part and parcel of dermatology, and they have experience of treating such patients. And before the lesions appear on the skin, it is better to arrest them right inside the mouth with the newer modalities of treatment.
Sir, are autoimmune blistering diseases contagious?
Not at all, not at all.
Sir, is hospitalization required?
See, it depends on the extent of the disease. If the blisters are present on the our thighs, or which are more likely to get friction, which can worsen the blisters or the wounds. And then the daily dressing with sterile material is required. If the patient cannot eat because of the sores in the mouth, then again for intravenous alimentation, hospitalization required. Not all cases require hospitalization.
Right, sir. And typically, sir, how long is the treatment needed?
In initial days, when there was no effective treatment available, lifelong treatment was required, and those immunosuppressant medicines like steroids, cyclophosphamide, azathioprine, they were like a double-edged weapon. They had many adverse effects, and not the disease, but the medicine themselves used to make the patient critical. But now, since the last 2 decades, we have got very new molecules which can treat this disease effectively, and we call it as a targeted therapy. Without causing any side effects, they treat the disease, and the quality of patient's life improves like anything.
Wonderful. Sir, can autoimmune blistering diseases be life-threatening?
Sometimes if the patient has associated diseases like heart disease or asthma or lung disease, or in especially elderly patients above 70 years of age, it is a tightrope walk like any other diseases, why skin diseases or autoimmune blistering diseases. In elderly patients, it becomes life threatening, and you have to be careful, treat the patient sometimes in intensive care unit as well.
Sir, are the blisters, wounds, or sores permanently curable?
Yes, with the new treatment modalities and depending upon which antibodies are there or which antigens are there, we can very much say that the prognosis is favorable. I am not saying that each and everything is curable, but now we can say yes, we can treat it in a better way. Earlier days we were nowhere, but now we have come to somewhere.
Right, sir. Some final words for the foundation.
So, first of all, I am grateful to my great guru, late Dr. Mohan Garpure sir, who introduced me the interest and created interest in this dreaded disease. And another expert, world or global expert, Professor Razak Ahmed from Boston, who is supposed to be the authority in blistering diseases. Both of them told me that Vaishnava Janato Tene Kahiye, Peed Parai Jane Hai. So you must feel the pain of the patients, and that's how I started treating my patients with empathy and personal care. And again, I will remain indebted to them, and I would like to pass on this little bit knowledge to my colleagues as well as to the needy patients. That's why, with the help of Mr. Ashok G. Suratwala, we have formed a pemphigus and pemphigoid or autoimmune blistering disease support group, which will help the patient to make aware of the side effects of the medicines, the newer medicines available, as well as to support few of the patients who cannot afford the treatment. Thank you very much.
Thank you very much, sir, for your time.